Good day everyone and welcome to this video. And in this video, I will be discussing about the vaccines covered by the Department of Health. But before we start, let me first introduce myself. My name is Chanel May Zamora Torres, a second-year student nurse from City University of Pasay, Section 2A. And let's get started with the most important public health programs in the Philippines, or what we call the Expanded Program on Immunization, or short for EPI, under the Department of Health. So, one of the goal of this program is to make sure that every Filipino child is fully immunized against common and preventable diseases. And through vaccination, we can reduce child mortality and promote healthier population. So now let's go over the vaccines covered by the EPI. And this includes the diseases they can prevent or when they are given and other important details. So let's get started with number one, which is what we call the BCG vaccine. So BCG vaccine stands for Bacillus calmette-guerin, and it prevents tuberculosis, especially its severe forms like TB meningitis and miliary TB. And it is given once at birth and usually before the baby is discharged from the hospital. So the dose is 0.05 ml for newborns and 0.1 ml for older infants. And of course, it is administered intradermally on the right upper arm of the baby. And this vaccine is very important because tuberculosis remains a very serious health problem in our country, especially to children's or newborn. And then the second one is the hepatitis B vaccine. So hepatitis B vaccines protects against liver infections that is caused by the hepatitis B virus. So it can lead to cirrhosis or liver cancer later in life. And the first dose must be given within 24 hours after giving birth or after birth to prevent transmission from mother to baby. And it is followed by 2 additional doses given at 6, 10, and 14 weeks as part of the pentavalent vaccine. And each dose is 0.5 ml, and it should be given intramuscularly on the right thigh of the infant. So the vaccine or this vaccine is one of the most effective when the first dose is given immediately after birth. And then the third one is pentavalent vaccine. So when we say pentavalent vaccines, it is a combination or combines protection against 5 diseases, that is the diphtheria, pertussis or whooping cough, tetanus, hepatitis B, and Haemophilus influenzae type B, and which can cause meningitis and pneumonia. And it is given at 6, 10, and 14 weeks of age with a 4-week interval between doses. And each dose is 0.5 ml, and it should be injected intramuscularly on the left thigh of the babies. And by combining those 5 vaccines into one, the pentavalent vaccine helps reduce the number of injections a baby can receive. And then the fourth one is the oral polio vaccines or the OPV. So the oral polio vaccines or the OPV protects against poliomyelitis, a disease that can cause permanent paralysis, and it is given at 6, 10, and 14 weeks of age through 2 drops administered orally. And this vaccines has played a huge role in helping the Philippines maintain its polio-free status. And then the fifth one is the inactive polio vaccines or the IPV. So, in addition to the OPV, we also have the inactive polio vaccines or the IPV. So this provides stronger protection by including immunity in the bloodstream, and it is given once at 14 weeks of age in a 0.5 ml dose intramuscularly on the right thigh. Together with the OPV and IPV, it ensures that children are fully protected against polio. And the sixth one is the pneumococcal conjugate vaccine or the PCV vaccine. So the PCV vaccine protects against infections caused by Streptococcus pneumoniae, such as pneumonia, meningitis, and ear infection. So it is administered at 6, 10, and 14 weeks of age with 0.5 ml per dose. And it should be given intramuscularly on the right thigh. So since pneumonia is one of the leading cause of death among children under 5, so the vaccine is it is extremely vital for the babies or for us to have. So the seventh one is the measles or measles containing vaccines, or MCV or MMR. So the measles containing vaccine, also known as MMR, protects against measles, mumps, and rubella. It is first given at 9 months of age with the second dose at 12 to 15 months. So the dose should be 0.5 ml and it should be given subcutaneously on the right upper arm. And lastly, measles can lead to serious complications, but complete vaccinations provide a lifelong protection. And the eighth one is the rotavirus vaccine. So the rotavirus vaccine protects against severe diarrhea and dehydrations caused by the rotavirus, and it is given orally at 6, 10, and 14 weeks of age with 1.5 ml per dose. And these vaccines is very important because diarrhea is one of the leading causes of hospitalization among children in the Philippines. Ninth one is the Japanese encephalitis vaccine. So the Japanese encephalitis vaccine, or the GE, protects against a viral infections that can cause inflammation of the brain. It is given once at 9 months of age with 0.5 ml dose, and it should be administered subcutaneously on the left upper arm. And this vaccine is especially provided in high-risk areas such as agricultural or rural regions. And lastly, the summary, which is the Department of Health's expanded program on immunization, ensures that every Filipino children receives a complete protection from these vaccines and preventable diseases. And each vaccine plays a vital role in strengthening a child's immune system and preventing a life-threatening illnesses. And as a future healthcare providers, it is our duty to educate parents about the importance of completing the immunization schedule, because every vaccine given is a step towards a healthier nation and healthier children, which is the future of our country. Thank you, and remember, sabi nga po ng DOH, bakuna ang proteksyon, kaligtasan ng bawat bata. That's all, and thank you so much.